Hello, my name is Kelly Schneider. I am the Restore Program Coordinator, and today you are tuning into the Restore Post-Surgery class or your discharge class. So this means that you are ready to make the transition out of the hospital. So looking forward with going home, some helpful tips, things that will really help with reducing the swelling are going to be ice and elevation. And so you're going to go home with your ice pack and 4 of the gel inserts. That ice pack, the ice stays frozen for 2 hours in the ice pack, and then it also freezes in 2 hours in the freezer. So you're able to rotate those every 2 hours. The ice packs that we're sending you home with, you're going to hear all kinds of information about how to ice, when to ice, where to ice. All I can tell you is the ice packs that we send you home with are completely safe to use 24 hours a day if you choose to do so. You just need to keep a protective layer between the ice pack cover and your skin. So putting your pant leg or a towel, a pillowcase, something in between there just to protect the skin. But using the ice and then elevating the leg. So elevating the leg means, yes, it's fine to sit in a recliner, but to really get benefit from elevation, especially for a total knee or if you're having swelling down below the calf and into the foot and ankle, you need to lay flat in bed and place 2 pillows or even more underneath the leg long ways so that your foot is above the level of your chest. So raise it up above the heart to reduce swelling. If you reduce swelling by using ice and elevation, you'll also have a reduction in pain. The big thing is that we ask that you don't sit for more than 2 hours at a time. We want you up and moving. It doesn't have to be get up and take a long walk, but get up, use the restroom, get up, get something to drink. Really be mobile. Don't, unless you're sleeping, we really want you up and moving every 2 hours. Again, ice as often as needed to relieve the pain. You're going to continue using that rolling walker until you're cleared by physical therapy. So the big thing with that is patients feel confident. They feel like, oh, I think I can go ahead and get rid of this walker. There's reasons that you're still on it. And so wait for that trained, skilled physical therapist to tell you differently. So as a PT, PTs are looking for muscle movement, proper step, proper heel strike. So those are some things we're looking at. And until you're really able to do those things well with the walker, you'll need to keep using it. It's also going to help in reduction of pain because whether you believe it or not, you're actually taking some weight off of that surgical leg. So that will help with reducing some of your pain. And then we ask that you do not get behind the wheel of any moving vehicle, no machinery, no cars, no tractors, no mules, no lawnmowers until you have returned to see your surgeon. And he will be the one that will discharge you and allow you to start driving. And that will happen at about that 2-week follow-up. So if you're a total hip and you had an anterior total hip, your precautions are do not cross your legs, do not twist, and avoid hyperextension. And that hyperextension is taking a step backwards with your surgical leg. So anytime you're stepping back, remember to step with the non-surgical leg first. If you're a posterior lateral total hip, again, no crossing the legs, no twisting on the surgical side, and you're the hip that can't sit in a chair or something lower than 90 degrees, no bending past 90. Those hip precautions are not forever. Your surgeon will tell you through x-ray when you can forego those hip precautions. Pain control. So most of our patients go home with oxycodone 5s. Oxy 5s we use because they do not contain Tylenol. So we're also treating you with over-the-counter Tylenol and Motrin. So the oxycodone you can take at any point during the day with any other medications. And that's why we usually choose that medication for most of our patients. If for some reason you are not taking the oxycodone, then the others that we primarily use, tramadol is another one we go to pretty frequently because it also does not contain Tylenol. If you're taking something different, then please clarify this with your nurse prior to your discharge, just to ensure that your pain medication, your prescription pain medication, if it has Tylenol in it, you'll need to monitor your amount of Tylenol. So again, most patients go home on the oxycodone. If that does not sound familiar to you, then please clarify that with your nurse prior to your discharge from the hospital. Some side effects of pain medicine are constipation, nausea, drowsiness, confusion, dry mouth, itching, and dizziness. Those all sound so exciting to go home with, but probably the one that we see the most complication with is constipation. And so what I'll tell you with that, laxatives, stool softeners, you've got to have them. So if you are taking pain medicine, you should be taking a stool softener. Those go hand in hand. If you have not had a bowel movement in about 2 days, you need to take a laxative. If you don't have the constipation under control, it can lead to a small bowel obstruction. That small bowel obstruction can lead to readmission into the hospital. So really be cautious with that. Drinking a lot of fluids and high fiber diet will also help with the constipation, as well as increasing at your activity. So being mobile is going to help with your bowels as well. So here is a chart that talks about your pain control options. So the first 2 columns, the Tylenol and the NSAID, those are over the counter. Those are what we are treating you with around the clock. So we usually alternate them. So we give you Tylenol, and then 4 hours later, we give you Motrin, and we continue that alternation throughout your day. So Tylenol, again, like we talked about with your pre-op class, Tylenol, you can take whichever you have at home. 325, your 500 is your extra strength Tylenol. The biggest thing with that is to be aware of how many milligrams of Tylenol you are taking in a 24-hour period. So if you are taking extra strength Tylenol and you're taking 2 tabs, then you're taking 1,000 milligrams per dose. So you're going to hit that 4,000 milligrams pretty quickly within 4 doses in a 24-hour period. So just be very cautious of that and be sure you're charting that. And then with your NSAIDs, again, that's whatever you have at home. Advil, Motrin, ibuprofen, Aleve, whichever one you like. Everybody has their own preference there. Those you just take as directed on the bottle. So again, the best rule of thumb is to take the Tylenol every about 4 to 6 hours, and then alternate the next dose when you're ready for another thing of pain medication would be to take that NSAID. The only thing with the NSAID is just to be sure that you don't take the NSAID and your aspirin at the same time. And that's why we usually start your day off with Tylenol, because we're also starting your day off with aspirin, which is your blood thinner, which I'll explain in just a little bit. And again, do not take 2 NSAIDs at the same time. So you can't be taking Motrin and Aleve or Advil and Motrin. You can't take those at the same time, just one from that column. And then your opioid, again, that is like we just talked about, the oxycodone, or if you're taking something different and that's the prescription that you're going to get filled at the pharmacy, that is your prescription pain medication. You'll take that also as directed and as needed. So the goal with pain control is to try to keep your pain controlled with over-the-counter medications, Tylenol and an NSAID. The opioid, we talk about using that as a breakthrough pain medicine. So maybe before therapy, maybe before bedtime, things like that. Trying not to take it regularly if you can, but then taking it as you need it as well. And remember, it can be taken with any other medication as long as it's one of those opioids that does not contain the Tylenol. Again, take the stool softener every day you take a narcotic. Very important. And because that's confusing, I have included in your discharge folder a medication charting sheet. On that medication charting sheet, when you leave the hospital today, your nurse is going to tell you when you took your last dose of each and every medication we gave you. So that's going to give you a starting point for your tracking sheet. So then you'll have a column for aspirin, a column for Tylenol, a column for that NSAID, and a column for the pain pill. Again, track it. How much did you take? How many milligrams of Tylenol? When did I take it? I promise you, when you get home, it's going to be confusing. And so it's going to be really, really important that you track what you're taking so that you and your coach aren't confused and you're able to stay on top of your pain medications. So blood thinners. So we use, for most of our patients, we use aspirin 325 once a day for 30 days. You're going to take that first thing in the morning with your breakfast, and you're going to do that for 30 days. Now, if you're someone who is on a blood thinner prior to surgery, you're going to be going home on a Lovenox injection, and then you'll be bridged back onto your prescription blood thinner. But again, your nurse will explain that to you specifically. So if you're one of those patients who takes a prescription blood thinner prior to having your joint replaced, you'll need to have this discussion in detail with your nurse prior to discharge from the hospital. Everybody else, if you weren't taking anything, you're going to go home on 325 aspirin, one aspirin for 30 days. And that's real important. Don't stop that because you're feeling well. It's very important to take that for the full 30 days. If you notice nosebleeds, bleeding from the gums, blood in the stool, or blood in the urine, these are signs that your blood may be too thin, and I just want you to report that information to your surgeon. I can, however, tell you that with the 325 aspirin, we don't see these being issues as frequently, but please just be aware that if you have any of those signs, that you need to let your surgeon know. As far as care for your incision, so you're going to go home with the Aquacel and Jumpstart dressing in place that was placed in the hospital. Then on day 7, you're going to need a dressing change. So that's 7 days after your surgery. So if you're receiving home health care, your home health care nurse will be responsible for changing that dressing. If you're in a facility, they will take care of that dressing change for you. And then if you are choosing to go just straight to outpatient, then we will need to train your coach and make sure your coach is comfortable with that dressing change. So we're going to send you home with all of the supplies that you're going to need for that dressing change. So you're going to go home from the hospital today with an additional Jumpstart dressing, an Aquacel dressing, some Safe Cleanse, and some gauze so that you can take care of that dressing change on day 7. So when it becomes day 7 and you're ready for your dressing change, you're going to be sure that whoever's making that dressing change has washed their hands, either with soap and water or with a hand sanitizer. They're going to remove that Aquacel dressing with a taffy-like pull. And so what that means is if you've ever had saltwater taffy, you know how it's real stretchy if you pull it. The Aquacel dressing is very similar. So to get it off, you're going to grab the corner and you're going to just start pulling and kind of stretching. What you're going to see is it's going to start to loosen that adhesive. You'll just go to the sides and pull and stretch on that dressing until the adhesive just loosens all the way around the dressing. If you were to go and try to tear that Aquacel dressing off like a Band-Aid, it will actually take the skin off with it. Remember, that's a waterproof dressing, so it's super duper sticky. So just make sure that whoever's taking that off, or if you're pulling off your own dressing, that you're really being gentle with it and just giving it some time for that adhesive to release. Once that's off, it'll take the Jumpstart dressing off with it. You're going to cleanse the wound with that wound cleanser. Just spray it on and pat it dry with some clean gauze. While you're doing this, you will put the Aquacel dressing either under your thigh or maybe behind your back, or whoever's changing your dressing can do that. That Aquacel dressing, while it's in that package being warmed, is going to help the adhesive be more sticky. So once you've cleansed the wound, you're going to put the new Jumpstart dressing on, but you're going to first spray it with the wound cleanser to moisten that Jumpstart dressing. Then you'll place the Aquacel dressing over the Jumpstart dressing, And you'll keep this dressing on for another 7 days. At day 14, you'll have a follow-up visit with your surgeon. At that point, he will remove that dressing. So he wants to be the one to take that dressing off, or they want it removed in their office so that they can see what the dressing looks like as far as if there was any drainage. And then they'll clean it. They'll remove staples if there are any, and then just check that dressing. So the only reason you would need another dressing change is if that dressing becomes saturated with drainage, or for some reason it's no longer intact. It's not sticking down. Remember, again, it's a waterproof dressing, so you're going to be able to get in the shower the day after surgery, and we want to make sure that that dressing is completely adhered to the skin so that we're not getting water underneath that dressing. Is information in your discharge folder about the Aquacel dressing. It talks about what the drainage looks like, what it looks like if it's not sticking, and then how to remove and reapply that Aquacel dressing. So if someone comes in or you need a reminder on how to do that, that information is in your discharge folder. At 2 weeks, your incision is considered fully healed. At that point, you can begin scar massage. Now, this massage is not like going to a spa and having a massage for relaxation. This massage is a little uncomfortable. But what it's going to do is it is going to increase circulation to that area. It's going to speed up the healing process, and it's also going to break down the scar tissue. You can use lotions or creams, vitamin E, coconut oil, something like that to help make it a little more comfortable. But what you're going to do is you're going to go to your incision. You're going to go across the incision side to side, along the incision up and down, and really rub hard. Get some of that tissue to break up under there. What that's going to do is it's going to allow you to have more motion in that joint. It's also going to let your scar lay down and look a little prettier too. So real important to begin that scar massage. We also ask that you please do not let pets sleep with you. Even when you have your dressing on, even if you're under the covers and they're on top, that pet will want to heal you. It's real important for them that you're better. And for them to do that, they're going to lick. They're going to lick your incision. If you have any openings in that incision, you're going to get an infection. So really important, keep those pets away from you, especially when you're sleeping, because you may not realize what they're doing. Things we want you to watch for. So if you have home health, remember that home health nurse is available to you 24 hours a day. So you can call them. If there's just something that it's keeping you up at night or it's making you worry, call that nurse. They've probably seen this before. They can brainstorm with you. They probably don't even have to come out. You can explain to them and they can tell you exactly what is going on over the phone. If it's something that you don't have home health or you feel like your surgeon needs to know, then call the surgeon's office when they open. Things that we want you to pay attention to, though, is your dressing staying in place? If it's not, you need to let us know. You need to let home care know. They may need to bring another dressing out. We may need to change that dressing. We don't want water getting underneath that dressing. If you have increased drainage, redness, pain, odor, or heat around that incision, and it's bothering you and it's really worrisome, then call. Those things are not normal. It'll drain a little, but a lot of drainage is not normal. It should not smell, and it'll be warm, but it should not be hot. And then if you yourself spike a fever of 100.5 or greater, we want to know about it. So please let home care know or let the surgeon's office know. Now, we want you to call the surgeon's office if you have increased swelling in one or both legs, pain or tenderness in one or both legs, even if it's just when you stand or try to take a step. If it's really, really intense swelling, pain, you need to let us know. Let the surgeon know. Warm skin, red or discolored skin, or if you notice that your veins are swollen red, hard, or tender to the touch, please call the surgeon's office. Those are signs of possible blood clots. What will probably happen is you'll go back to the hospital. You'll have a Doppler ultrasound to check the flow of the blood through the veins and the arteries just to ensure that there's nothing wrong. Now, if you have shortness of breath or chest pain, this is a 911 call. This is a blood clot. It has broken off and has gone to your lung. It is a pulmonary embolus. It is life-threatening. So please call 911. and get medical help right away. Now remember, you're going to set off metal detectors for the rest of your life. So if you're at the airport, you're at the courthouse, anywhere that there's a metal detector, you just need to tell them right away, hey, I've had my joint replaced. Please just scan me. We don't do the cards anymore that show you've had your joint replaced because people can make them. So they don't even look at those anymore. So just tell them right away, I have a new joint or I have a joint and I need to be scanned. No dental appointments for the next 3 months. The dentist won't even see you for 3 months after your surgery. So reschedule those if they're already made. And then please have an open line of communication with your dentist. So there's been some changes recently in regards to antibiotics and dental visits. And so right now, what is being said is that for just general dentistry, teeth cleanings, checkups, things like that, there's no antibiotic needed. But if you are having some kind of dental surgery, maybe a tooth extraction, a root canal, something like that, then you may need to take an antibiotic. And that antibiotic will have to be obtained from your orthopedic surgeon. So please just be aware of that and have that communication with your dentist so that you can do what's best for your joint when you're having your dental procedures.
The ambit pain pump functions and return instructions. So the ambit pain pump is made for the total knees. So if you are a total knee, you already have this pain pump attached. It was placed in the recovery room and it began running right away. So the pain pump itself is set to run every 2 hours, dumping 8 cc's of Marcaine or bupivacaine onto the nerve in your inner thigh, which then controls the pain on the top of the knee. So it's an 8 cc dump of medication every 2 hours, but then remember, you do have the option if you are in pain or any kind of discomfort in between that 2-hour automatic dose, you have the option of a 4 cc bolus, and you can push those every 30 minutes. You get 2 of them in between the 2 hours. So with the pump set to run like that, the pump will last about 5 days. When the pump is empty, all you're going to do is simply turn the pump to the off position by rotating the bottom portion counterclockwise. So you can see that in the picture there below. It spells off, O-F-F. So just rotate the circle through the line, make sure it spells off, and you have turned your pump off. So then you're going to remove the cassette from the top of the pump by placing your thumb and index finger on either side of the pump tabs, press it in and up at the same time. That will release that cassette, and that's where the tubing is housed, and so you're going to be able to dispose of that cassette, the medication bag, which will be empty, as well as the black carrying case. You're more than welcome to keep that little black carrying case or fanny pack if you would like, but everything is disposable. So you're going to place the shipping cap back on where the cassette was connected. So that shipping cap should be in your mailbox. You'll just place that back on top. The reason for that is to protect the motor. So just line up the tabs and snap them in place. If for some reason the shipping cap didn't come home with you and you don't have that, just please cut all the IV tubing off of the cassette cap and leave that cassette cap on top. That way that motor is protected. You're going to place this pump into the bubble wrap sleeve that was provided, and you're going to seal it closed. That way that pump is nice and safe in that shipping box when it is returned back to the company. You'll follow the instructions for assembling the USPS box, which we should have made that box look like a box when we sent it home with you. You'll place the pump inside the box, and then you'll seal the box closed. Please don't forget to include your patient survey in that box. We really value your feedback and want to know what your thoughts were on the function and the utilization of this pump. It allows us to really streamline our work here at Hill Country Memorial by having your feedback. We also encourage you to write down or even snap a photo of the tracking number located on the front of your prepaid mailbox for your records. The reason for that is if the company doesn't get the pump back, you will be held responsible for the cost. So Hill Country Memorial is only allotted so many pumps. These pumps are reusable, so they're sent back to the company. They're cleaned, disinfected, and then sent back to Hill Country Memorial. So we want to make sure that we are able to maintain our specific number of pumps and that they're coming back to us. So as soon as you're done, as fast as you can, get it returned to us. You're going to place that box in your mailbox or drop it off at your local post office. If you have any questions or concerns about this pump is new to us, and it is exciting because the company really, really stands behind this pump, and they're available for the patient. So please call the company if there are any questions or concerns, and their number is 832-791-6048. All right, so if you have any questions, you can reach out to them. You can always reach out to me, but definitely that company is the expert in this pump.
Right, that concludes the discharge class. And so my number is there on the screen if you have any questions or concerns. Again, I'm Kelly Schneider. I am the Restore Program Coordinator. My number is 830-990-6134. If you have a nursing-related question or want to talk to somebody on the Restore unit, that number is 830-997-1299, and they are there 24 hours a day, 7 days a week. So that's always a good option for you if you need to speak with someone. I just want to take a minute to thank you for choosing Restore. We are very aware that you can choose any hospital you want, and we're so glad that you chose Hill Country Memorial and are part of our Restore Champion team. We wish you all the best in your recovery and look forward to hearing from you and seeing you again when you've recovered. We hope that all goes well for you. And again, thank you for choosing Restore.